Start taking control of your health with functional medicine expert and nurse practitioner Darrell Handwerker. And now, another episode of Integrative Insights, where Darrell, with over 2 decades of real practical experience in functional and integrative medicine, brings the best of today's holistic medicine to you. Nothing in this program should be taken as medical advice. This is for educational purposes only. Consult your healthcare practitioner about anything discussed today before making any changes.
Hello, everybody. This is Darrell Handwerker, family nurse practitioner here at South Florida Integrative Health Center, where we get to the root cause, the underlying causes of these contributors to aging. We all want to age well. And how do we do that is by studying the scientific literature out there. What causes aging? What are these root causes of chronic diseases that are reversible and preventable? And how can we be proactive and take control of our health? And how can we as functional medicine practitioners help our patients to reach optimal levels of health? So hello, everyone. We are here at South Florida Integrative Health Center, helping people get healthier. And today we're going to talk about heart health and the root causes of heart health. Number one is we've all been blaming cholesterol and LDL cholesterol as the bad cholesterol, and focused in on medications that address that and literature and research that only address those two biomarkers, cholesterol, total cholesterol, and LDL, and what are the medications that work for that. Now, we see recently that fish oil works well with triglycerides, so that's another biomarker that has now come into focus as a major biomarker, a major focus, because triglycerides are more likely to become those problematic lipids or fats that end up clogging the arteries. And that is what is so important, is what causes the obstruction of the arteries, the arteriosclerosis type process, arteriosclerotic plaques. These are all words and phrases meaning that the plumbing is getting blocked and plugged up or obstructed. The arteries are being blocked. And what is that process? And when we understand that process, we can address the root causes. That's what we do here in integrative medicine. We look at these root causes of heart health and not just focus in on cholesterol or LDL, but really these underlying contributors. So let's go through these so we can understand that. Number one, insulin resistance. See, quite often people are only seeing if they are diabetic or pre-diabetic by just measuring an average of their 3 months of their blood sugars, which is an A1C, or their glucose level when they get their blood drawn. But they don't measure insulin levels, and high insulin levels can really begin this process of the clogging of the arteries, this inflammatory process. Higher levels of insulin can really be problematic, and those need to be measured at the right times along with glucose levels, because insulin and glucose, they go together. Number two root cause is, as I mentioned, inflammation. You want to be able to measure if there's systemic inflammation, because that can now wreak havoc on the cholesterol and the LDL particles that, again, we're focused on cholesterol and LDL, but what is making them turn into these small, dense particles that end up clogging the arteries? And that is inflammation is one of the root causes, and the first one that we mentioned is as well. So inflammation, and then the next root cause is methylation. Methylation is a process that uses these B vitamins and other fats and amino acids, and it creates these new byproducts. One of them is called homocysteine, and that's been implicated or associated with the what they call endothelial dysfunction, the irritation of the arteries or inflammation of the arteries. And this is again something that is based on the process known as methylation. So here in South Florida Integrative Health Center, we really work at getting methylation optimized. It's a process in the body. You don't want it too low or too high. You really want it optimal for each unique individual has their optimal level of methylation, because it's a process that the body uses to detox toxins, to make our neurotransmitters, and to work as creating antioxidants to protect us from damaging toxins. All of this, and it also helps to remove hormones. So all of this is this process of methylation. But if this process is off, then it creates a byproduct called homocysteine that is irritating and inflammatory to the arteries and can begin this process of the clogging of the arteries. And that's what's so important. So we have insulin resistance, inflammation, methylation. The next process or root cause of heart health is when the blood becomes more coagulable, more coagulated, more sticky. And we want to measure that. There are definitely good biomarkers and blood tests that can let us know if the blood is becoming more coagulated, more thicker, less sticky. And that is a problem when it comes to heart health. And we really want to work on making the blood more viscous and not as coagulated. That's an important factor in a root cause of heart health, is when the blood gets thicker and less viscous or less more hypercoagulable. The next root cause is vitamin insufficiency or deficiencies of vitamins. And again, we bring that up when we talk about the B vitamins creating homocysteine, which is inflammatory, but also other nutrients that are so essential for heart health, such as vitamin E, which are quite often depleted in our food supply, and other fat-soluble vitamins like vitamin D. And of course, with heart health, we're talking the mitochondria. So we want all those nutrients to be optimized for mitochondria health. So you see, heart health is much more than just focusing in on cholesterol and LDL. It's to get to these root causes of heart health: insulin resistance, inflammation, poor methylation, and hypercoagulation, and vitamin insufficiencies. These are some of the most important root causes that we address here at South Florida Integrative Health Center, that we optimize to prevent and reverse these chronic diseases, especially heart disease. If you have any questions, please reach out to us either on our website, which you see there in the corner. You can book a discovery call there, or reach out in the comments below. Let us know what you think, any comments or questions, and you can direct message, and our phone number is in our bio. Everyone have a healthy and happy day.